Welcome to our channel Biomed Savvy. Today, I'll be presenting on the topic wound healing process. Wound healing is a complex, highly regulated biological process that restores the integrity and function of damaged tissues following injury. It involves a coordinated interaction between cells, extracellular matrix, cytokines, and growth factors. Large number of cell types, including neutrophils, macrophages, lymphocytes, keratinocytes, fibroblasts, and endothelial cells, are involved in this process. Wounds generally heal in 4 to 6 weeks. So this figure, it shows the different stages of wound healing, which I'll be explaining now. The wound healing process is classically divided into four overlapping phases: hemostasis, inflammation, proliferation, and maturation or remodeling. The first phase, hemostasis, begins immediately after a tissue injury. Damage to blood vessels activates platelets, which aggregate and form a fibrin clot. This clot not only prevents blood loss but also serves as a temporary extracellular matrix scaffold for cell migration. Platelets release growth factors such as platelet-derived growth factor (PGDF) and transforming growth factor beta (TGF-beta), which initiate the healing cascade. The second phase, often called defensive or inflammatory phase, which typically lasts from 1 to 3 days. During this phase, vasodilation and increased vascular permeability allow plasma proteins and leukocytes to enter the wound site. Neutrophils are the first cells to arrive and are responsible for phagocytosis of bacteria. This is followed by macrophages, which play a critical role by removing debris and secreting cytokines and growth factors that regulate the proliferative phase. The classical signs of inflammation are erythema, edema, heat, and pain are evident during this phase. The third phase is the proliferative phase, characterized by tissue regeneration and neovascularization. The fibroblasts migrate into the wound and synthesize collagen, mainly type 3 collagen. Angiogenesis occurs, leading to the formation of granulation tissue, which provides oxygen and nutrients to the healing tissue. Simultaneously, keratinocytes proliferate and migrate across the wound surface in a process known as epithelialization, while myofibroblasts contribute to wound contraction. The final phase is the maturation or remodeling phase, which may continue for several months. During this phase, type 3 collagen is gradually replaced by type 1 collagen, and collagen fibers are reorganized along lines of tension. The vascular density of the wound decreases and the scar tissue becomes paler and stronger. Although tensile strength increases significantly, it rarely exceeds 70 to 80% of normal tissue strength. Several local and systemic factors influence wound healing. Local factors include infection, oxygenation, and wound size, while systemic factors include age, nutritional status, metabolic disorders such as diabetes mellitus, smoking, and the use of corticosteroids. In conclusion, wound healing is a multi-step, dynamic process requiring precise cellular and molecular regulation. A clear understanding of these mechanisms is essential for effective clinical management of wounds and prevention of complications. Thank you for your attention. We'll be back in a next video.